So we know that care leavers are more than likely to struggle with their mental health. So we were able to use funding from ARC KSS to look at what those needs of care leavers were and how the COVID had impacted on them during and post lockdown. We were able to bring in research to undertake a national survey, and that national survey told us that 70% of those care leavers that responded talked about their mental health being affected. 55% of them talked about being lonely during and after lockdown. And a quarter of those care leavers didn't feel safe in the housing that they were in. We brought together groups of care leavers to work with us and co-produce and co-design artwork, videos, and what was most important, messages for other care leavers and messages for those working with care leavers about what they suggested that they needed support on and how they could be supported during lockdown. It's absolutely critical that care leavers were involved all the way through the research programme and also the implementation of this work. We had a care experienced researcher as part of the Beyond Lockdown research team. We had care leavers that were involved in developing the key messages for other care leavers and those working with care leavers. We had care leavers working on developing blogs and videos and some of the artwork and the resources. And we had care leavers involved in expert groups looking at what the research was telling us and how that they could take that forward. We created 2 communities of practice earlier this year. Invitees included Department for Education, NHS England, representatives from all leaving care services across Kent, Surrey and Sussex, voluntary and community sector, and most importantly, care leavers themselves. At the first community of practice, care leavers were able to talk about the research, share their video, and share their artwork and their key messages. And we were able to ask stakeholders, call them to action and ask them to pledge their support for care leavers' wellbeing on the back of the research and the messages that they'd heard. The second community of practice was held in March this year, and we were able to look at the progress that had been made against the 35 pledges that had been made across Kent, Surrey and Sussex. And I'm delighted to say there was an incredible amount of progress that was made. We were delighted at both communities of practice to have the National Care Leaver Advisor from the Department for Education, and he was able to really champion some of the progress that had been made and feed it back up into government. Following the communities of practice, the care leavers were then invited to attend the National Benchmarking Forum for Care Leavers, and they will be presenting on the 12th of May this year to other care leavers across the whole of the UK, across 120 local authorities, using the messages that they've co-designed and co-developed, looking at the research and further developing the messages that can be taken out to all other local authorities across the UK. So we're delighted that this research and the implementation has been spread nationally.
So my message to care leavers would be stay positive as much as you can, try and be hopeful and optimistic about the future.
You're not the only one that's, finding it tough at times. There's a lot of other people out there who may feel exactly the same as you, but there is so much support and so much things that you can access for help and support around the stuff that you're feeling, money, that sort of stuff. Keep in contact with the people that care for you. And all in all, remember, although we're in lockdown, we can push through. We are strong. Care leavers always have been. So just push through and we'll get through it. See you on the other side.
So early in the pandemic, there was growing research evidence as well as media reports suggesting ethnic minorities in the UK were experiencing a disproportionate impact from COVID. That was both on morbidity and mortality. And among the minority groups particularly affected or more at risk of these poor health outcomes were older adults from the Asian populations. Research also shows that culturally tailored health communication is not surprisingly, more acceptable and increases understanding. And the media had also picked up on this fact. So there were press articles and criticism that public health information on COVID was not hitting the spot and lacked sort of cultural nuance. So we focused our research on 2 South Asian communities. So older adults from South Asian backgrounds often share living spaces with younger people. They might have a prevalence to conditions such as hypertension or diabetes, diseases that make them as an individual more vulnerable to COVID-19. However, it was really important that we recognise the cultural differences within these communities and didn't just treat them as one. So the study was all about building relationships with both Hindi-speaking and Nepalese-speaking communities. We wanted to work as equal partners in co-producing the provision of health information and health information that was understood and spoke to those communities that we were working with. And this approach was used from outset and throughout the project, so including the proposal and the design and the co-production and implementation of the health information resources. This allowed the research team to listen and get a real deep understanding of the issues, what information should be included in the leaflets, and how the communities wanted to receive the information. The research team ran a community of practice event with community groups, public health colleagues, and health and care practitioners across the region, so sharing both the process and launching the co-produced leaflets. And by listening to the community, we knew that whilst digital versions of the leaflets were acceptable, there was also a request for hard copies to be printed and distributed throughout the local communities in Kent, Surrey and Sussex, which the research team have also provided. The digital leaflets were then shared across the region through our ARC networks and our AHSN networks, and this ensured a wider reach and interest across the UK and abroad. And I think for me, the important message to take away is to change the language used to describe working with diverse communities or ethnic minorities, which are often termed as hard to reach. The communities we work with were really keen to participate and share their experience and help ensure that the information provided was culturally appropriate, and this helped ensure engagement and understanding. And it was a real privilege to be part of this project.